In one of his last acts as governor, Charlie Baker established 25 new community behavioral health centers across the state and launched a 24-hour behavioral health helpline. It was the culmination of nearly 2 years of work on what his administration called Roadmap for Behavioral Health Reform, aimed at increasing access to mental health services and easing reliance on emergency rooms for care. I was able to visit one of the new centers yesterday to see how these kinds of facilities work. And now for a look at what kind of response they've been seeing so far, I'm joined by Kathy Mague, Senior Vice President of the Behavioral Health Network, which operates a community behavioral health center in Springfield, and Vicker DiGravio, III, President of the Riverside Community Care, which runs a center in Milford, and the one I visited yesterday in Norwood. Kathy Mague and Vicker DiGravio, III, thank you so much for joining us.
Thanks for having us.
So, I want to begin with asking you just to tell me a little bit about these centers. Kathy, can you tell me what kind of care is offered at a community behavioral health center? How is it different from what happens now?
Yes, I'm thrilled to be able to share this. So at the Behavioral Health Network, we call ours BHN Wellbeing, and the idea is it's a one-stop shop for whole health wellness care for individuals with substance use and mental health challenges. So what's different is that one thing is that there is no wait for care. So when you are looking for services, we get to serve you immediately. The second is, in the past, we only had one tool in the toolbox, which was therapy. And now we have lots of tools in the toolbox. We have peers and recovery coaches and community health workers that are looking at things like housing and food and transportation. So what you need, we're able to address. The way we like to say it is, stop in when you're ready and we'll meet you there.
I mean, it's basically like urgent care, but for mental health.
Correct, exactly.
And Vicker, there's 3 different kinds of care that are provided here, right? It's not just sort of that urgent care walking in the door.
There are 3 components, exactly. So one component is this, what we call lowercase CBHC, which is traditionally outpatient services. Then there's the mobile crisis service, which is we have teams of individuals that will go out and respond to individuals who are in crisis in their homes, in their schools. And then we have what's called crisis stabilization, which is a 24/7 level of care, where individuals who don't need to be in a hospital, an acute inpatient setting, but maybe need to be someplace for 4 to 5 days so they can be stabilized and kept safe. The CCS is the 3rd component. So it's 3 legs of the stool.
We've had a real problem in this state, and I think it's a national issue with just not having enough resources available to help people who are dealing with mental health and behavioral health crises. I spoke to one parent of a teen who spent 2 weeks in an emergency room, waiting for an inpatient bed to open up. And that's been a problem for some time. Is this going to help? Is it going to address that problem?
We hope so. We hope so. I'm not sure it's going to solve the problem entirely, but the idea of this urgent care capacity that Kathy spoke about, the mobile crisis teams, hopefully we're going to intervene with folks, whether it's a child, an adolescent, or an adult, before they have to go to the emergency room and before they need acute inpatient stay. So if we can get to folks earlier, one of the great things about this model is we can wrap supports around these individuals that we never have been able to do before, and hopefully keep them safe and keep them healthy in their communities and stop them from ever having to go to an emergency department.
What kind of supports? What are we talking about beyond just sort of the usual therapy?
Sure. So as Kathy mentioned, right, so therapy, traditionally, that was the only tool in the toolbox. Now we have individuals with lived experience, certified peer specialists, recovery coaches. We have care coordination, but we also have enhanced medical capacity as well. So we have phlebotomy services. We have increased nursing so that we can address some of these folks if they have low-level medical needs as well, and just treat them much more holistically than saying, okay, we'll provide you therapy services, but you've got to go over here for your blood work, and then you've got to go someplace else for your medical care. So it's the idea of treating people holistically in an environment that's respectful and makes them feel welcome.
And Kathy, one of the things that's different about this is how that's paid for,
yes.
right? Can you speak to me a little bit about, and tell us about the bulk sort of payment of this if you have Mass Health?
Yes. So individuals with Mass Health and as well Health New England Commercial has joined this. So folks with both of those insurances are eligible for the service. So it's called bundle payment, but it's based on the same activities that we will have used in the past. So an individual therapy code or psychiatry evaluation and management visit, but instead of triggering just the payment for that service, it triggers a much higher rate, which is called a bundled payment. And so the expectation is that for that bundled payment, the providers have this whole range of other services that are not necessarily unit rate billable.
Right. So I mean, the idea there is it's more than just it's being paid for differently. That the intention is that that's going to really make a difference in terms of what services people wind up getting. Right.
Right. And here's a perfect example. This is one of my favorite examples. Is in the past. When you have children in families where the child has ADHD, for example, or behavior problems, and the parent is really struggling, in the old system of community behavioral health, we could not do a parent group without diagnosing the parents and billing for the parent. So because the child is the patient, we didn't get reimbursed for doing a group with parents who can share. That's one of the best modalities, is for people with similar experiences to share together.
Yeah. With
this model, because the bundle payment pays for wraparound services, we can have parent education programs and drop-in programs.
Okay. Vic, one of the issues that we've seen in the state is that there's a really shortage of people who work in this industry, increasingly so, right? Should this make a difference in terms of staffing? Do you have enough staff to be able to handle the demand?
Yes, so the short answer is yes, in the short term. Staffing has always been an issue for our industry, and I think it always will be, but the increased reimbursement rates, the investment the state has made in this service has allowed us to pay better salaries, so we now can compete with hospitals, health centers, other healthcare organizations that typically we would lose staff to. The other thing about this service, though, that's helped with staffing is it's truly a historic, revolutionary type service. We have people who want to work in the CBHC because they see that we're able to provide a level of care and a different type of care than they've ever been able to do historically. So people want to come to work in CBHCs, which is really exciting.
One of the issues here, though, is that not everybody necessarily has access to that full suite of services offered in this one payment, right? Mm-hmm. If you have Mass Health, which is the state's Medicaid program, you have access to this. Or, you know, I think you mentioned some other limited insurance companies are doing it. But across the board, most people with private insurance can't access the full suite of care that you provide, right?
Right.
So what's up with that?
Well, I do believe, and Vic probably knows more about this than I do, but I do believe that we're working hard, the state is working hard to get other insurance companies on board, understanding the importance of this level of care for their members. And I think in the meantime, none of us will turn people away if they're coming to seek care with us, but the full array of services is available to folks with Mass Health. Vic, do you have other?
Yeah, I think one of the commercial insurance, Optum, is purchasing the service on the eastern part of the state, which is great. But I think part of it's going to take some urging from state government. But commercial insurers need to step up to the plate. This is a service. It's a service that is a legitimate service. It's built on evidence-based practices. There really should be no reason why a commercial insurance product should not offer this benefit to their members.
Okay. I reached out today to the Massachusetts Association of Health Plans, and they said that some plans may be planning to contract with CBHCs, and others may be still evaluating it, but they said, you know, the program is, of course, still in its early stages. It just launched this month, so right. there's a chance that they may still do it. The state also just launched this behavioral helpline, a phone number that people can call to get matched up with services. How does that tie into this, and is that going to make a difference?
Yes. So the way I'm understanding is really is a no wrong door. So there are three options for folks. There is the state central line. There's also the 988 number.
Yep.
And so from the perspective of a community member, you can call your local CBHC directly. You can call the state central helpline. You can call 988. And the idea is that they're all connected. And the state central line is staffed 24 hours a day with master's level clinicians. Their goal is to take some of the heat off the local sites and do some triage to determine what really does an individual need and then get them to the right level of care so that they're not waiting in wait lists for services that are not relevant and won't help them.
Okay. I mean, there's been a documented increase in mental health issues in the state and nationally since the pandemic began. Vic, it sounds like this is not going to solve all of our behavioral health problems in the state, but is it a start? Is it getting us in a direction we need to go?
It's a very important start. And one of the things that we need to remember is that we have experienced 40 years of underfunding and neglect of the community behavioral health system. This is really transformational, but it's not gonna fix 40 years of underfunding in 4 weeks or 4 months, maybe 4 years, 5 years, but it's a very important step.
Okay. Vic DiGravio and Kathy Mague, thank you so much for joining us today.
Thank you.
Thank you, Craig.